All right. Hello, everybody. I'm Jessica, functional nutritionist, here again to talk about an exciting topic. I'm getting over a cold, so bear with me. I'm a little congested still, and that might be a topic coming up, how to get through a head cold and congestion through nutrition and lifestyle. I definitely thought about that topic as I was not feeling the best this past week. Anyways, what we're going to focus on today is something that is not only near and dear to my heart, but is also a very commonly asked question among any patient I work with. And not just a question, but really the ability of how to navigate through something. So what we're going to talk about today is how to navigate through a flare-up. And flare-ups, yes, are very commonly related to autoimmune conditions, but they're not just related to autoimmune. I mean, a lot of people have gut-related disorders, SIBO, or just, IBS or dysbiosis of some kind. And you experience flares with that as well. People with osteoporosis, that's not an autoimmune condition, but you can definitely have flares. And so really, this is such a big topic because I think it's really hard for people to figure out, first of all, what caused the flare up, and also like how do you navigate through that if there's multiple variables. And I also think within the functional medicine world that a lot of patients are more inclined to directly go to food. Oh, food, there was a certain food that caused it. And yes, of course, as a nutritionist, I am here to tell you that 100% yes, foods can cause flare-ups, but that's not always the main cause. And it may be a multitude of factors. It could be, food and stress and sleep and all these different things that are contributing. So that's really what we're going to talk about today. But I also really want you all to have a better understanding of the immune response and, how different factors can affect that. Because really when we look at inflammation, inflammation is being produced by, certain cytokine responses within our body, and cytokines are part of the immune response. And so there's many different areas of our body that produce immune cells. The gut obviously is one of the biggest ones, but they're produced all over the body. And so when we're really looking at the immune response and how that directly impacts our inflammatory response in regards to certain triggers, I think it really gives people a better understanding of like, wow, it's not just food, but it's also these other things and they can all work together. And so that's something I really want to put all the puzzle pieces together today for you all. So let's dive in. So what is deemed a flare-up? I mean, anybody who has had a flare-up is very well versed on this, but not everybody has, or maybe this is very new to you as someone who's experiencing inflammation in your body in whatever way that might be presenting. And so essentially a flare-up is just an exacerbation of a chronic disease or symptom state, and it occurs when symptoms of that disease or, symptom can present and suddenly worsen and then kind of calms down. So it's basically a ramp up in inflammation of any kind. So for example, if you have arthritis, then a flare-up would be considered when you're having, worsening stiffness, pain, swelling than you typically have. So anything that's kind of increased or more severe than usual. Excuse me. So the big question, what causes a flare-up? Again, this is so different for everybody, but it is the most highly sought out question from any person who does experience inflammatory flares. And it's really, what triggered this? And this is really what I help patients work through is, current flared states or really finding what works well for their body, what foods, what lifestyle factors, what can we really work on to help you gain a better understanding and knowledge and education behind your body and what it needs. So that way, if you do get into a flared state later on down the road, you go, you know what, me and Jessica worked on this or me and my practitioner worked on this, and I know exactly how to get through this because I know I shouldn't have done this, and I know that's a trigger for me. So this is really something that's important that we navigate through. And it can stem from, stress, lack of sleep, new medications, supplements, any type of lifestyle shift. Of course, food, as we mentioned, any type of shift can really contribute. And a lot of times it may not just be one, a flare-up can be exacerbated by maybe you have high stress, which leads to poor sleep, which poor sleep is leading to poor food choices, which poor food choices then lead to lack of movement. You're just feeling blah. So it can honestly pile up to where there's a multitude of factors really playing a part, and really having to navigate through that and saying, okay, well, what really triggered this to begin with? So if we look at food contributions, so food contributions are probably the top thing that people really point to, really looking into, okay, did I eat anything new? Or, oh, I had gluten. It must have been the gluten. And so I wanted to kind of highlight each area. We'll talk about food, we're going to talk about stress, and we're going to talk about sleep. Excuse me. And so, as I've mentioned multiple times now, food can certainly be a trigger, but it's not always the main trigger. But I really wanted to share, I had a former professor that I was with through my master's program, and she was honestly amazing. Her name was Dr. Heather Zwicky. And she, I'm a very visual learner. And so for me, her teaching methods really helped me gain a better understanding of how things really work in the system, in the body. So I'm actually going to share some of her slides of what she, taught to us and really helped me gain a better understanding of how these things work with our immune system. So I'm going to click out of this real quick and end up sharing my screen here. And so what I really wanted to show you all is, first of all, and these are all her handwritten notes. So, bear with me here. It's not going to be typed out, but I really do think these are beneficial. And she was so amazing at describing, and I hope I can do it justice. But as I mentioned, the immune system is present in many, many organs throughout the body. Obviously, as you can see here, the gut has most of that. But it's in the lymph, the blood, the skin, the bone marrow, the spleen, the lymph nodes. Like there's so many different areas that this is present in that we need to be aware of that. And that's why a lot of times people might have great gut health. Maybe the immune system is being affected in a completely different area. So it's just most commonly that people think of the gut because that is where most of our immune system is hosted. 80% of it is there. So I just wanted to point that out first. Now, this is another thing I wanted to point out before we really dive into food is that there's a lot of triggers. So intestinal permeability, we've talked about this before, is when your tight junctions in your gut start to separate and it lets through undigested foods, pathogens, bacteria, and then it gets through your intestinal barrier and then creates an immune response because underneath that, that's where your immune cells are. So when you do have poor gut health and or maybe you don't have poor gut health, but all of a sudden you're noticing that you are. When you have poor intestinal permeability, there's a lot of different factors that can play a part in triggering that to occur in the first place. And one thing I wanted to highlight, which is what we're going to talk about today, is poor diet. When you do, let's say you did really well for like 2 to 3 months, you were eating all the right things, then you started to feel better, and then you started gradually dabbling into different things. Maybe it was dairy, maybe you shouldn't have eggs, maybe it was gluten, who knows? But when you start dabbling into things like that, and then maybe you start to notice an increase in symptoms, poor diet can really trigger an onset or a flare-up again. Nutrient insufficiency, stress, which we are going to talk about. Stress is a big one. I mentioned medications. So there's toxic overload, toxic exposure. So all of these different things can lead to intestinal permeability, which is then going to lead to an immune response. So I just wanted to highlight how important it really is to not only look at food, but all these other factors that can really play a part in an immune response. And then if we really focus in on food now, so this is a great pictorial of if you are to eat something, what happens in the body. So she's got this great guy here. Maybe it's a girl, but he is about to eat an apple. So you eat the apple, and then eventually what happens is the apples go, get digested. They eventually reach the gut, and you've got these little apple bites that are in the digestive area. We have villi, which are these little kind of hair follicle type things that are on our intestinal lining. And so this is where the apple is going to kind of come through and present itself. And then what happens is we have dendritic cells, which is what these are right here that she's drawn. The dendritic cells are part of our immune system. They are what basically, they're going to take up that little bit of digested apple, and they're going to present it on this little antigen presenting area. It's called an MHC. We call it the hot dog and bun in the nutritional world in my schooling. And basically what happens is this dendritic cell is going to present the apple to our CD4 cells. So our CD4 T cells, everybody has these. This is all part of the immune response. And what happens is it presents to your CD4 cells, and this is what your body does to create either a response or no response to food. So if all goes well, it presents it to the CD4 cell. You have a response, which is a TGF beta response, so your T regulatory cells. And this means you create antibodies for this food, but all goes well. It creates an IgA response is what we call it. And IgA is an immunoglobulin. I'm sorry, I know these are a lot of big words, but I just wanted to show you kind of the mechanism at play. And if anybody has worked with a functional medicine practitioner, these are things that might come up, inflammatory cytokines or immunoglobulin support, things like that. So essentially what happens in layman terms is your immune system, takes in this apple that's been partially digested, it presents it to your immune cells, and your immune cells either say friend or foe. And if they say friend, great, you produce antibodies that say, I can keep eating this, and you have tolerance to that food. Now, let's say that you don't have tolerance to a food. So this is kind of showing hypersensitivity. So let's say, for example, you eat something you're not supposed to. You have a known trigger. You have worked with a functional medicine practitioner or maybe a nutritionist, and I can't have gluten and I can't have certain nightshades, maybe tomatoes or peppers. Let's say you eat that. So you eat that food component. Again, it goes through your digestive tract. It gets presented to this dendritic cell, which is part of your immune system, and then presents it to your CD4 cells. But instead, what it gets produced is a Th1 response, which is, you have Th1 and Th2 responses within your immune system. And these create different cytokines. And so what we see here is this TNF alpha. This is an inflammatory cytokine. And so what happens is that TNF alpha stimulates inflammation within your body. This Th1 response triggers your cells to produce a different immunoglobulin response, and you start to create this, domino effect of inflammation and oxidative stress within your body, and mostly your gut, because we're talking about food. And so you can see here that there's different inflammatory cytokines, which we call, IL-1, IL-6, TNF alpha. And so what happens is you eat this piece of bread, and I mean, when we're sitting there eating, this is not a thought process in your mind. You're not going, oh my goodness, if I eat this piece of bread or if I eat this tomato, what is this going to happen and what's going to happen in my body? Nobody thinks that way because we're just enjoying our meal. But this is what I really wanted to show you, to go, gosh, there's so much more going on within your system when you eat that food component. And so, I'm very, very big on saying, look, if we're eating right 80 to 90% of the time, it's okay for your system, for the most part, most people. It's okay if you have 10 to 20% of the time, those little indulgences here and there, if you're doing everything right. But there's that balance. And if you're in an active flared state, or maybe you're not in an active flared state, but you're making poor food choices, you have high stress, you're not sleeping well, all of those things are going to topple on top of each other, and your body's going to be overwhelmed and start to become in this flared state. And so this is what I really wanted to show you, is why that happens in the first place. Too much of something can really cause this. In small amounts, it may not be as disruptive to your system if you're in a really good, healthy, stable place. But if you're more vulnerable, this is what's going to occur. You're going to eat this food. It's going to create a whole immune response and release these pro-inflammatory cytokines, which then can present in a lot of different ways, because as many of you know, or maybe don't know, there's a big connection between your whole body and the gut. So you may be producing pro-inflammatory cytokines here, but it can also affect your neurotransmitters, your mood state. If I eat gluten, I get extremely irritable. So, and that's something to be aware of, is 2/3 of our neurotransmitters are produced in the gut. And so all of these things can impact one another and really cause a flare-up. So, I hope that wasn't too overwhelming. I geek out on this stuff, and so to me it's really exciting, and I love to teach you all, but I also don't want to make it too boring to where you're like, I don't know what this girl's talking about. She's talking about immunoglobulins and all these different things. So I'll try to keep it in layman terms and really something that you guys understand, but hopefully enjoy also seeing the kind of breakdown and mechanism of all this, because it is really fascinating to see that it's not just you eating a whole cake to yourself and not knowing why you're in a chronic flared state. You know, this is the mechanism behind it. Excuse me. So now that we've kind of talked through food contributions, let's talk about, stress or anxiety. Stress is a huge trigger for people. Stress is a huge trigger for me. I have Crohn's disease, which is an autoimmune condition in the gut. And I could be eating everything right, getting proper sleep, but if I have high stress, I immediately notice symptoms flare up in my Crohn's. And this is such a big place for everybody. I mean, every patient I work with, they go, oh, I don't know what's happened, Jessica. I've noticed that all my symptoms are flaring up. And when we really talk through it, one of the biggest things we circle back to is stress. Oh yeah, I did have a really stressful, week at work last week, or I'm having a lot of family things happening right now. So this is something that shouldn't be ignored, but should also, be managed well. So again, I wanted to show you the stress response from the professor that I've been showing you. And this is just another way for you to see that it releases pro-inflammatory cytokines when you have a stress response. So when you have mental emotional stress, what happens is that anxiety produces pro-inflammatory cytokines. So when we're looking here, this IL-6, you're getting an increase in that, and that's leading to an increase in TNF alpha. Those are both pro-inflammatory components. And so what we see here is that anxiety is causing just as strong as an immune response as food is, if not more, or stress. And so you can see here that, again, there's an immune component that is causing inflammation within your body, and that is being triggered by this mental or emotional state. So how do we navigate through this, and what do we do? There's a lot of different things, but what we really need to realize is that we need to get this inflammation down, because it can lead to inflammation all over your body, and it might be specific to your, symptoms that you typically experience. Let's say you typically get headaches, maybe, bowel shifts, maybe some skin reactions, anything like that. It could correlate more with what your symptoms are, but sometimes it can be very different. It could just pop up with something totally different that you haven't noticed before. So we really want to get all these things under control and get your flare up down. That way we can get you back to a place where you're feeling good and you're like, okay, I've gotten through this and I know what helps me. So I added this kind of picture here so you could see all the different areas that stress can impact your body. So for your skin, it can cause skin problems like acne, psoriasis flare-ups, eczema, dermatitis, breakouts. So a lot of different skin issues can be flared up from stress. When we're looking into, what they have listed here is the head, so your brain and everything, it can have contributions to your mood state, anger, depression, irritability, anxiety, panic attacks. And so a lot of times I'll work with patients where they're like, wow, like my anxiety went through the roof when I had really bad stress the other day. Or if we look at the heart, you know, I've had patients that have heart palpitations that are triggered by stress. You can have increased blood pressure, decreased nutrient absorption in your intestine, reduced metabolism. So a lot of times when people say, oh, I can't lose weight, well, cortisol triggers insulin and all these other things that hold on to weight. And so when you're stressed out and you're releasing these hormones all the time, it can have a huge impact on that. It can, you know, disrupt your reproductive system. It can cause joint and muscle inflammation and pain. We just talked about a big, you know, support from the immune system. So it can suppress the effectiveness of your immune system, which can then make it harder to recover from not only your flare-up, but if you get sick or anything happens, like your immune system is compromised. It's in this imbalanced state where it's just producing inflammation. So a lot of different things here that stress can contribute to, which makes this a very, very big topic for me, you know, as a nutritionist and working with patients on lifestyle. That is a big focus. All right, so we're shifting gears to sleep. So sleep is also a big one. And I think people are really surprised with how they think they're sleeping well. But after we kind of dig a little bit deeper, what we really find is that sleep is actually a big area that we need to focus on. If you're going to bed at midnight or 1 a.m. every night and you're sleeping till 9 or 10 and you're still getting those 8 hours, is that adequate sleep? Yeah, I mean, you're getting your 8 hours, but your sleep cycle is very disrupted, which disrupts your hormones, your all these different things, your circadian rhythm, all these different things. So I kind of put in here, you know, sleep deprivation can be associated with alterations of your innate and your adaptive immune responses. So there's definitely a correlation there, which leads to the chronic inflammatory state and then increased risk for obviously anything that's immune related that could be immune compromised. Sleep deprivation also contributes to increased TNF alpha, which again, we talked about as a pro-inflammatory component within the immune system that is released. Reduced sleep quality can increase risk of infection. Obviously, we've talked about that on the past slides when your immune response is compromised. And then it can accelerate disease development by, you know, producing those pro-inflammatory cytokines. So we need to really highlight not just the food aspects, but realize that there's so many other areas that really do contribute to inflammation in our body and that immune response that's really, you know, pushing out that inflammation. So I had this here that I just wanted to show all of you. So if you see, you know, you've got your sleep deprivation at the top there, and then it really highlights to the left all the inflammatory cytokines that can be released from sleep deprivation, which are ones we spoke about on the past couple slides. And so what happens is these, you know, inflammatory cytokines filter through the circulation, the lymphoid tissue, and then they trail down and create responses that can increase infection, neurodegeneration, cardiovascular disease, obviously increased risk for certain things like cancer. So we really can't, what do I want to say? I really don't want people to think that sleep is not a big deal. I mean, we all know we need sleep, but do you really know the intensity or severity that we need sleep, or how that can contribute to flare-ups and then immune responses that can lead to other things? So minimize, that's the word I was looking for. We don't want to minimize how much sleep can contribute to our overall health and well-being. So again, I hope this wasn't too science-y or, you know, geeked out for you. Like I said, these are things obviously that are near and dear to my heart that I really love learning. But the whole point of me doing these informational PowerPoints is I really love sharing with all of you and trying to give you a better understanding of how deeply rooted these things can really go and why, you know, it is so important when I make silly recommendations like positive affirmations or putting sticky notes on your mirror that set mindset and intention for the day to keep your stress low, or stretching or listening to calming music before bed to really create a good sleep hygiene and routine. Some of these things might seem so minimal, but they have the biggest impact if you look internally of what's really going on inside your system at a chemical level. So again, how do we work through these flare-ups? Well, obviously this is different for everybody. It's not going to this is not cookie cutter by any means. And I'm not saying, hey, everybody, if you have a flare-up, go do A, B, C, and D. That is not what I mean by any means. But there are certain things we can really try to focus on and try to make sure that we're optimizing. And one of those things is food. So really trying to think back, was there anything I ate in the past couple days that really contributed to my flare up? If there was, take them out. Hey, we just had the holiday. It's the 4th of July. I had hot dogs and I ate the bun and I had hamburger and dairy and popcorn or, whatever it was. Okay, not the end of the world. Let's take it out. Let's get this flare up calmed down. And then you're good to go. So it's just that factor of recognizing if there is any food contributions. If there were no foods reintroduced, sometimes just reverting back to a very clean immune supportive approach can be necessary for a short time. So let's say you've been eating little pieces of chocolate here and there, or you've been having sugar here and there or pastas and you've been fine. You haven't noticed anything. Well, now you're in a flared state. So we need to really focus in on anything that could be contributing to even more inflammation and kind of reel that in a little bit. Not that you can't ever have those things again in moderation, but when you are in a flared state, we really need to focus on getting the inflammation down, which means kind of pulling back a little on some things maybe you were tolerating before that aren't as supportive as they should be. So really focusing on like a vegetable rich, fruit in moderation. Fruit has a lot of antioxidants, which is good for oxidative stress and inflammation in our body, but also sugar. So we don't want to cause too much havoc there. Healthy fats, a lean protein rich approach, really just, again, having that antioxidant support to reduce the stress on your body. Looking at stress. Okay. Have you had increased stress? Some of us find it really difficult to dig to that deep level and go, no, I feel fine. I haven't been stressed. But then if you really think about it, you're like, well, my mom called the other day and she's not doing well and she's having financial issues. And then the school called about my kid the other day and I thought I handled it well. But maybe you start to realize like, wow, I actually did have a lot of stressful things happen last week that maybe I didn't recognize. That could be kind of contributing. And so I really love working with patients on creating daily rituals, habits, routines, things that can really create concrete stress management and really create a healthier stress response in your body. And there's different ways for stress management for everybody. I mean, some people love reading a book, some people hate reading a book. So it really is going to be kind of navigating through like, what do you enjoy? What brings you peace and calmness? And it may be simple techniques like deep breathing, journaling, reading, being outdoors in nature, or maybe it's participating in a specific hobby that you enjoy. Maybe you really I love adult coloring books. I will sit there and I'll just do an adult coloring book for 30 to 45 minutes and it really just puts my mind somewhere else. I love doing it. It's a creative outlet for me. Some people like gardening. Whatever it is for you, utilize that, but do it more than just in that active state of stress. Yes, we can utilize things like deep breathing or kind of removing ourselves from a situation when we do have that active state of stress. But even when we're not actively feeling stress, we should participate in these things because they will create a healthier stress response moving forward, that maybe you won't have these flare-ups as severe or as often if your body's in a better place to really respond in a healthy way rather than a more severe way. The Institute for Functional Medicine has obviously really great handouts, as I've highlighted in the past. And so this is a great one that talks about stress management techniques. And as they point out, stress is unavoidable. It's not something that we can remove. A lot of people, for example, let's say one of your main stressors is your job. Most people aren't going to quit their job. So it's more so about managing through that stress and really finding ways to implement things. And so they have a great handout here that talks about, daily suggestions, weekly suggestions, different things that you can try, that I kind of went back to on the previous slide, but I wanted to include this just in case anything was missed or anything that kind of triggers you to think, oh, wow, I should try that. And maybe it's something new you try. Maybe you've never tried yoga before and you want to try it, or maybe you never tried maybe you don't get massages and you're like, hey, I'm going to go get a massage, so finding ways to really help and implement that on, a daily or weekly basis. And then the last topic is the sleep aspect. So are you getting adequate sleep? And as I kind of mentioned before, I think a lot of people might not even realize. They go, yeah, well, I go to bed, I get my 8 hours, but maybe your sleep routine is off. Maybe, like I said, you're going to bed at 1 a.m. and waking up at 10, or maybe you're eating right before bed and that's disrupting your sleep. You're waking up in the middle of the night a lot, or, whatever the case may be. We really want to focus on good sleep hygiene. Sleep hygiene is basically referring to what is your nightly routine. Do you sit and watch TV at night? Do you play around on your phone? Are you on your iPad or your laptop? We really want to remove any type of stimulants 45 minutes to an hour before bed, realistically, because what happens is the light exposure, even, and time again, I have people that go, oh, well, I have that blue light blocker, or I have the night mode on my iPad. Yes, those things are helpful, but we're still stimulated by something. We're still having a stimulant right in front of us. And so realistically, we want to get rid of that. And light in general is going to stimulate cortisol, not melatonin. So we really want to try to remove that and instead replace it with something else that's really calming. Maybe you take an Epsom salt bath. Maybe you read a book before bed. Maybe you meditate. Maybe you stretch a little bit. Some people like listening to calming music. There's those different apps now, like the Calm app will literally read a book to you to go to sleep. You can, have a essential oil diffuser and put some, lavender scents or different calming things in there. So there's a lot of different things you can try rather than, going straight to the TV or, your phone. And I've had a lot of people that give feedback that say, oh, well, the TV really helps me fall asleep. And believe me, I get it. I used to, when I was younger and a teenager, I watched TV before bed every night and it helped me pass out. But we know now that that is not giving you good quality sleep throughout the night. You may fall asleep easily, but your quality of sleep may not be the best throughout the night. So again, another handout from the Institute for Functional Medicine, but really ways to kind of help with better sleep. As you can see on the left there, we just talked about minimizing or avoiding stimulants, really trying to address any time of like nighttime tension or anxiety, sleep planning and preparation, paying attention to light, noise, temperature in the room. Like, if your room, middle of summer, if your room's really hot right now, that's probably affecting your sleep. So maybe trying to get like a fan or something in there. Noise canceling. If you have noisy neighbors, putting something with white noise on to help you. So I just wanted to include this as a good way for you to see how we can incorporate some of these sleep hygiene type things, and really the importance behind it. And then just some examples of antioxidant-rich foods. A fun one is dark chocolate. If you get 70% or higher in small amounts in moderation, dark chocolate can actually be really beneficial. Pecans have a ton of antioxidant support. Obviously, some of the berries, blueberries, strawberries, goji berries, raspberries, artichokes, the leafier greens like kale and spinach, red cabbage. Cabbage has a ton of antioxidant properties, and then even our legume family like beans. So there's a broad range of food that you can really focus on. And like I said, even if you feel that overall you're eating healthy, maybe just try to focus on some antioxidant rich, foods during this flare up, because maybe it's just something like that really needs to support your system that much more. So, I hope this was helpful. Again, I hope I didn't just completely geek out on my own here, and I hope you all felt like this was relatable, but also understandable with all of the more medical terms with the immune system and things like that. But I just felt like it'd be really great for all of you to have a better understanding of really what's happening in your system when these things occur, and understanding that it usually is rarely just one component. It could be food, stress, sleep. It could be all of them together. And so really digging deep with myself, your practitioner, or yourself, and really trying to find what is contributing to it. So I hope you all enjoyed, and I look forward to seeing you all next time. Okay, bye you guys.